أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. Hello viewers, today lecture is lecture number 4, that is cholinergic or cholinomimetic drugs. In the previous lecture we have discussed about the autonomic nervous system, its various components, its various mechanisms involved there. In today's lectures we have to briefly discuss the drugs that are acting on cholinergic receptors or parasympathetic nervous system. Before proceeding toward the drugs acting on cholinergic receptors, let's briefly discuss that what is parasympathetic nervous system. Parasympathetic nervous system is a type of autonomic nervous system that is responsible for the stimulation of various activities, for example rest and digestive conditions when the body is at rest, especially after eating. After that, there are some characteristics of parasympathetic nervous system which are as follows. Dilation of blood vessels in the skin, decreased heart rate, that is also known as bradycardia, increased secretion of digestive enzymes, that is enhancement of digestive workout, constriction of smooth muscles of bronchi, increase in sweat glands, mean increase in sweat production, that results in cooling, contraction of smooth muscles of urinary bladder. After that, the cholinergic receptors. Cholinergic receptors are present in our body at various locations. Cholinergic receptors are classified into M1, M2, M3, nicotinic and muscarinic, both A and nicotinic. The M1 receptors are present in the secretory glands present in our body and responsible for the activity like salivation, sweating, lacrimation, etc. The M2 receptors are present in the heart that decreases the heart rate, also known as bradycardia. The M3 receptors are present in the smooth muscles present in the body in various locations, that is gastrointestinal tract, genitourinary system and respiratory system of the body, and responsible for the contraction of smooth muscles, urination, etc. The M3 are also present in the pupil and ciliary muscle of the eye. When the muscles of the ciliary and pupil contracts, it results in meiosis that has some beneficial effect and we have discussed it later. The nicotinic plus muscarinic receptors are also present in the skeletal muscle and plate and responsible for the contraction of skeletal muscle. The nicotinic receptors are present in autonomic ganglia and responsible for the secretion of epinephrine or adrenaline. After that, let's go to our main topic, that is cholinergic drugs. Cholinergic drugs are also called parasympathomimic, cholinomimetic drugs because their action mimics the action of parasympathetic nervous system. The cholinergic drugs stimulate parasympathetic nervous system in the same manner as does the acetylcholine that is naturally present in our body. Cholinergic drugs may stimulate cholinergic receptors directly or indirectly. By indirectly, cholinergic drugs slow or inhibit the metabolism of acetylcholine and hence the blood concentration of acetylcholine increase, mean enhancement of parasympathetic activity. Now cholinergic agonists are of two types, that is direct acting and indirect acting. Here is the classification of the cholinergic drugs. Cholinergic drugs are classified into cholinergic agonist and anticholinesterase. Cholinergic agonists are further classified into choline esters and alkaloids, which includes the following drugs: acetylcholine, carbachol, methancol, muscarine, pilocarpine, and ericoline. And the other class of cholinergic drugs is anticholinesterase, which further include reversible and irreversible. By the term reversible, we mean that their effects are reversible, and by the term irreversible, we mean that their effects can't be reversed. Reversible anticholinesterase include carbamates and ecridine, and irreversible include carbamates and organophosphates, that includes the drugs given in the table. Now we have to discuss direct acting cholinergic agonists. Direct acting cholinergic agonists bind directly to cholinereceptors, that we discussed earlier, that is M1, N2, N3, and so on. Direct acting cholinergics are lipid insoluble, mean that it doesn't really enter the central nervous system, so their effects are cerebral. And it's resistant to the metabolism by acetylcholinesterase, mean acetylcholinesterase does not degrade the direct acting cholinergic agonist. Their effects are longer acting than with the acetylcholine, and it includes the following drugs: acetylcholine, methacholine, carbachol, methancol, muscarine, pilocarpine, and ericoline. After direct acting cholinergic, we have indirect acting cholinergic agonist. By indirect mean their effects are indirect, mean they inhibit the acetylcholinesterase enzyme, and when the acetylcholinesterase enzyme are inhibited, the acetylcholine degradation is not possible. They are not degrading their blood concentration in acetylcholine, their blood concentration increases in the synapse, and hence the enhancement of parasympathetic nervous system. And when the accumulation of acetylcholine occur, mean when their concentration increases, the nicotinic and muscarinic receptor activation will be increases. Anticholinesterase drugs are further classified into reversible or irreversible inhibitors of acetylcholinesterase. And when the reversible cholinergic agonist and irreversible cholinergic agonist. Reversible cholinergic agonists include neostigmine, phytostigmine, icothiopate, pyridostigmine, malathion, idroponium, tricrine, donepezil. And irreversible indirect acting cholinergic agonists are classified. Irreversible indirect acting cholinergic agonists are also called organophosphates, that include ferrathion, carbamates, carbaryl, and diplos. When the acetylcholinesterase